Again, today I want to talk a little bit about the behcet disease. Behcet disease is a type of the inflammatory disorder which can affect multiple parts of the body. The most common symptoms include painful mouth sore, genital sores, inflammation of the part of the eye, and arthritis. The sores typically last a few days. Most commonly, there may be inflammation of the brain, spinal cord, blood clots, aneurysms, or blindness. Look right here. We have these photos. It's about the eye manifestations. Look right here. The first one is fundusco photo left eye sensor on the optic disc. For the second one, look, just like the eagle eye. We call this the eagle eye or the hypopyon, which can be seen in the anterior uveitis in a person with a behcet disease. The inflammatory eye disease can be developed in early disease courses lead to the permanent vision loss, 20%, blindness. But sometimes we can have it with the posterior uveitis, anterior uveitis, or the retinal vasculitis. Look to the heart, what you can have. Pericarditis. Pericarditis, a frequent cardiac manifestation, chronic aortic regurgitation due to the aortic root disease may be also have been seen. For the blood vessels, we have the problem observed in 7 to 29 persons with their arterial lesions, and for the vascular lesions. And also, we can have the stenosis, aneurysms, or the pseudoaneurysms. Now let's go to the causes or the reason behind this disease. It's autoinflammation of the blood vessels, but sometimes it's come before the complication for the infections, especially the bacterial infections. This one, with the Streptococcus pyogenes, Mycobacterium tuberculosis, and sometimes with the viruses, with the herpes. Look right here. I want to talk a little bit about the erythema nodosums. The erythema nodosums, EN, is the inflammatory conditions characterized by the inflammation of the fat cells under the skins. That's what we have in the behcet disease and the skin problems or the issues with the symptoms. Look, that's one. It's like a little bit what we have it for the HLA B51. We can use it also for the diagnosis. Now let's go to the map. Look, first of all, I want to show you this the mouse already have it through the behcet disease. And this too. Look right here for the neurological symptoms is we have paralysis, strokes, seizures, transient ischemic attack or TIA, memory loss, and training sensation. For the psychological depressions and the loss of the ambitions, it doesn't matter. Now let's go to the mouth. We call it aphthous ulcers. For the GID, you will have mimics, inflammatory bowel disease, IBD, ulcers, stomach ulcers, abdominal pain, digestive problems. For the genitals, the sores too, we have the ulcers, the aphthous ulcers. For the skin, what I said, erythema nodosum, rash, phlebitis. For the extremities, we have the deep venous thrombosis. For the joints, we have the arthritis. For the cardiovascular systems, we have the aneurysms, stenosis, thrombosis, heart valve damage, inflammation of the heart. In the eye, you have the uveitis, the hypopyon, the vision loss, the blindness, the optic nerve inflammation, the sensitivity for the bright lights. Look to the central nervous system, the CNS. We have the meningoencephalitis, the cerebral venous sinus thrombosis. That's the map where we have it through the behcet disease symptoms. Let's go to the treatment. Right here, I want to talk about it. Okay, look right here. we have the infliximab. The infliximab, we will be targeting the TNF alpha, the tumor necrosis alpha. So we need it to treat the Behcet disease. The apremilast, it's for real the pseudodeasterase number 4 inhibitors. The azathioprine is for the metabolic, anti-metabolic drugs. The dapsone is antibiotics. We can use it for the infections. Also, we can use the penicillin with it. Also, we can use this with just like the inflammatory actions, anti-inflammatory drugs. Look, this one, the thalidomates, the thalidomide. This one for the modulators, drugs, immune modulator. Now let's go to the colchicine. The colchicine is more specific for the gout, for the familial Mediterranean fever, but we can use it also right here with the Behcet disease. Thank you for watching, and I hope you enjoyed this video. Thank you.